title of this podcast is Cause of Death in Dialysis Patients, Discordance Between National Registries. We really appreciate the opportunity to describe our work in the CJSN podcast. My name is Dr. Tariq Shafi, and I am a nephrologist and epidemiologist at Baylor Scott and White Health in Temple, Texas. And I'm the corresponding author on this study.
And my name is Dr. Yoshitsugu Obi, and I'm a nephrologist at the University of Mississippi Medical Center and the first author of this study.
So we sought to understand the accuracy of cause of death reporting for dialysis patients. This is an important topic because the specific causes of death are often used to determine the disease burden and risk factors in the dialysis population. For example, data from USRDS suggests that cardiovascular disease is the leading cause of death, with sudden cardiac death accounting for almost 40% of all deaths in patients receiving dialysis. Next, I will ask Dr. Obi to describe the study design. Dr. Obi?
Sure. So we use data from a cohort of adult dialysis patients with over 6,000 deaths that occurred between 2003 and 2009. We classified the causes of death as sudden cardiac death, other types of cardiovascular death, cancer, infection, and other causes. The unique feature of our study was that we were able to link our data to the National Death Index, or NDI, which is considered as the epidemiological gold standard for cause of death evaluation. So we had causes of death from two national resources. Then we compare the causes of death listed in the USRDS with those in the NDI.
So, what did we find?
Yeah, we found substantial disagreement between we found substantial disagreement between these two national databases. Notably, the USRDS reported twice as many sudden cardiac deaths as the NDI, and only about a third of the deaths classified as sudden cardiac deaths by the USRDS were classified as such in the NDI.
That's a striking difference. What do you think is driving this?
Probably a combination of factors. The two databases have different ways of collecting information. The USRDS relies on the USRDS death notification form filled out by dialysis facilities, while the NDI uses death certificates completed by healthcare providers who might have more clinical data at the time of death. We also found that USRDS was more likely to classify deaths outside the hospital as sudden cardiac death.
Interesting. So, why is this important and how does it affect patient care?
Our findings highlight the possibility that we are misclassifying sudden cardiac death in this population. It can be difficult to diagnose, and deaths from other causes might be mistaken for sudden cardiac death. This misclassification can have serious consequences, potentially leading to unnecessary procedures or treatments. It might also mislead clinical trials that rely on this data to test new therapies.
Thanks, Dr. Obi. We need better ways to track causes of death in dialysis patients. This might involve simplifying the reporting forms or requiring more input from nephrologists. We hope this research encourages further investigations and improvements in how we care for dialysis patients. We also hope that the USRDS can link its data to the National Death Index and make it available to researchers. We hope that this podcast has helped to raise the awareness of this important issue. Thank you for listening.
This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or other qualified healthcare professional if you have any questions about any medical condition or before taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast from the American Society of Nephrology.